Cameron Masters Finch Challenge pre-exercise screening. Hello Mike.
Hello.
Hello Michael.
Nice to meet you.
Lovely to meet you, buddy. Alright, so today we're going to be doing some pre-exercise screening. Now, the idea behind pre-exercise screening is to make sure you don't have any pre-existing illnesses or injuries that could affect your training. Okay? Alright, so first of all, we'll just ask you a few questions, alright? So I just want to know, what are your goals? Why are you here? What is it you want to get out of this?
Well, he plays at AFL to a representative level.
Okay.
And he's been pestering me for a little while now to do extra strength and fitness training.
Excellent.
To improve his game.
Brilliant.
So that's why we're here today.
Wow, fantastic. So, just to confirm, you want to do strength and conditioning training to improve your AFL game?
Yes.
Excellent, okay. Well, in that case, we'll get on with the assessment. So, what we do is we use what's called an exercise readiness questionnaire, okay? Have a look at that one.
Yep.
Okay, makes sense? Now, we do these with adults as well, however, because you are a young one, we need your parental guardian. Right, thank you for joining us. We'll start with a couple of questions, so we'll need your details first. So, first name?
Michael.
Michael, no problem. How'd you spell that one, Michael?
Michael.
Brilliant.
And Beasley.
B.
Beesley.
Excellent. Alright. Okay. What's your age, Michael?
I'm 10.
10. Your date of birth?
It's August.
1st of August.
Yeah, 1st of August.
1st of August. That's no problem. Male, obviously. Alright. Name of the parental guardian? Mark?
Mark Markham.
Mark. How do you spell your second name, Mike?
Markham.
Excellent. Right, I just need your address.
Number 62. Old
Yep.
Coach Road.
Yep.
Maslin Beach.
Maslins Beach. Postcode?
5170.
Alright. Your mobile phone?
0466
Yep.
4242.
Brilliant. Do you have a home phone that we can use?
No, not anymore.
No, no problem. I'll leave that one blank. Do you have a work phone we can call you on?
Yeah. 0578
Yeah.
962 74.
Brilliant. Has a GP or allied health professional referred your child? I'm assuming not, since he was the one who was asking.
No.
Brilliant. There we go. Okay. I need an emergency contact here.
So that'll be myself.
Yeah, it was yourself, Mark, no problem. Okay, Mark.
Same numbers. Same address.
Alright. Same numbers, address. Excellent. Alright, so we have some medical questions here that I need to ask you.
Yeah.
Alright. Does Michael here suffer from any heart conditions?
No.
No. Type 1 diabetes?
No.
Epilepsy?
No.
Breathing problems?
No.
Cystic fibrosis?
No.
No. Type Type 2 diabetes?
No.
No. Seizures or convulsions?
No.
No. Asthma?
No.
High blood pressure?
No.
High cholesterol?
No.
I should hope not. Any eating disorders at all?
No.
No problem. Any unexplained coughing after exercise?
No.
Brilliant. All negative for that one. Right. Is your child currently taking any medications?
No, he isn't.
No, okay. In the last 6 months, has Michael here had any joint or bone pain?
Well, he did suffer from Osgood Schlatter disease
Okay.
in his knee, but we went to physio, had several physio sessions, and the physio's passed him clear, so that's all good now.
Excellent. Okay. Well, even though it was 6 months ago, we'll put it down just as a precaution.
Okay.
Any injured or broken bones at all?
No.
Any muscular pain while exercising?
No.
Nothing?
No.
Excellent. All right. Okay, so does your child have any chronic disabilities or illnesses?
No.
No. Good to hear. Does your child have any difficulty / problems with vision?
No.
No. Hearing?
No.
Speech?
No.
Motor skills?
No.
Balance?
No.
Sleep?
No.
Brilliant.
Do all those quite well, don't you?
Alright. Are you allergic to any food? No. Any medication, pollens or allergies?
No.
Nothing?
No.
Excellent. Alright. Does your child, does Michael here follow any special diets?
No.
Not a vegetarian, are you, Michael?
No.
Like your tucker?
Definitely not.
Sensational. Alright, has your child had any surgery in the past 12 months?
No.
No. Brilliant. Okay. Is there any reason at all you can think of why a child could not participate in exercise?
No, well, he trains 3 times a week already, so
You seem pretty eager.
Yes.
very good, yeah.
Excellent.
He plays on weekends as well, so.
Alright. So, I have a question for you now, Michael. Alright. What are your favourite hobbies and activities?
Definitely playing AFL
Playing at AFL. I had a
Whenever I
feeling that
can.
would be the answer.
with my mates.
Yeah? Do you have fun while you're doing it?
Yes.
Sensational. That's what I like to hear. Okay, so the next part of the legal document, okay, it's just informed consent. So, I'll just read this next section out for you. It's just legal, you know, mostly, but I'll read it out for you anyway. I hereby acknowledge that the information provided above regarding my child's health is, to the best of my knowledge, correct. I will inform you immediately if there are any changes to the information provided above and give you permission for my child to commence the exercise program.
Absolutely.
Alright.
Right.
Do you or do you not consent? I'm assuming you are saying yes.
Yes, yeah, yeah.
Fantastic. Okay, I just need your signature next to the little star that I'm going to mark down. Your full name and print. Yeah, I've just marked out the sections there we need to do.
Thank you.
Excellent. Thank you. I'll sign this next bit. Alright, so we have a couple of performance measures we need to do before we get stuck into your exercise routine, before we start planning something for you, okay? I need to take your height, your weight, I need to do something called a BMI measurement. BMI stands for Body Mass Index. It's a percentage of your body fat, lean muscle mass. Okay, it gives you an indication of how.
Tells you how skinny or fat, yeah.
Thank you for that one, Mark. Tells you how skinny or fat you are. I was trying to be nice about it. Okay, and we have to do a couple of ratings for that one. Okay, I also need to do a couple of tests, but I'll cover those in a minute. So, Michael, do you mind standing up for a moment? I've got to take your height measurement.
Okay.
Alright, so, stand here for me. Right, nice and tall. Try and put your head through the ceiling.
You should be about
145. Exactly, spot on. There we go.
Oh, great.
You're 145 centimeters tall. There we go. 145 centimeters. Okay. We also need to take your weight as well. So I have some scales here. If you just pop your shoes off for me, mate. Thank you. Pop on the scales for me. Excellent. Thank you for that. 34 kilos. Alright, I can do a BMI rating for you there. There we go. Okay, I also need to take your waist measurements. So, I just realised I don't have a tape measure.
Do that one.
Do it with this one, you're.
Yes.
Okay. Oh, alright. Just take your waist measurements if that's alright, buddy. So you just hold your hand above your head for me. Thank you. Brilliant. Thank you for that. Okay, so you can take a seat now, guys, that's alright. We do have a few tests that we need to run, okay? I'll just talk you through them, okay? We have an aerobic test, which I don't think we need to do. As you mentioned before, you play AFL regularly and at quite a high level, so I'm safe to say that your aerobic capacity is quite high, okay? The muscular endurance test. Now, how many push-ups do you think you can do, Michael?
14.
14! That's a lot of push-ups. Look at that. Up rather good. Yeah. Now, flexibility test. All I'm going to get you to do for this one is just take a seat on the floor for me. Alright.
Okay.
Put your chair in for me. Alright. So take a seat on the floor there, right? Yeah. With your feet close together. As close as you can get them, alright? With your hands together like that, I want you to reach and try and touch your toes and go as far as you can, okay? Now, how easy would you say that is on a scale of 1 to 10 to touch your toes there?
So 10 being the highest?
10 being the absolute hardest you've ever tried in your life, 1 being falling asleep.
5.
5, okay, so safe to say you're very flexible. Good flexibility level as well. You can take a seat now, Michael. Well, excellent. I think that covers everything. I don't think there's anything else I need to go over. Brilliant. All right. Does anybody have any questions before we finish this one up?
Don't think so.
No problem. Well, this concludes the testing. Thank you very much for coming in. We'll get in contact with you shortly.
Thank you for seeing us.